Right, welcome everybody to our Tuesday evening. We're going to do a slightly different format this week than previously, in that we're going to start with a talk and then end up with some stories afterwards, because we've had quite a few testimonies coming through over here, which is brilliant. I love it. Let me share my screen. Okay. All right, so we are going through the body a little bit at a time and slowly but surely. So we've done the head, we've done the neck, we've done the shoulders, we've done all the other bits and pieces, we've done the skin. And now we're going down to these things, the hands, which I think we tend to take a little bit for granted. And if you start to lose your hand, miss a finger or two, damage your wrists or whatever, you'll suddenly realize how dependent we are on those tools. So the hands and fingers are the remote sensing devices. Unlike your toes that are furniture finders, we've got a little bit more control over our hands. And our hands are actually storytellers, and they reflect the nutritional world in which they live. They will become swollen if vitamin B6 is lacking in the diet. And obviously, these are all signs and symptoms of various things and could be one of quite a few different things, but these are some of the big ones that Jim is talking about over here. One of the things that we know about in a lot of people is arthritis. They'll come in complaining about crooked fingers, pain in the hands. And we're getting into the sort of things or the sort of area that I deal with quite a bit in my work on a daily basis, where people complain of arthritis in their hands, stiff joints, stiff fingers, that sort of thing. Allergy can make the fingers ice cold or stiff. So you can wake up and your hands feel like they've been sitting in a bucket of ice cold water. But there's obviously no ice cold water anywhere around, and they're very stiff. And that could be allergy, or it could be arthritis, could be a couple of different things. And then arthritis can lead to swollen and deformed joints. And I'm sure we all know people and have seen them with these really crooked, clawed hands, which can be extremely debilitating. One of my downlines, Shelley, who unfortunately couldn't be with us tonight, I've known her for many years because she was a patient of mine up in Empangeni. And back in my early days of Neolife, I was to try and stupid to actually get her involved then. But she did start taking the full motion, and it has made a huge difference in her life, the full motion and the salmon oil, to the extent that she can now actually play piano. She still drives. She does all sorts of different things with her hands, despite the fact that they are still clawed and she's still got the arthritis, but she can do significantly more than what she should in fact be able to do. Nails can also provide an early warning system of impending difficulties. Our fingernails grow at a rate of about 3 millimeters per month and can take almost 6 months to grow out from the nail bed, which is basically where the nail comes out from the skin going outward. And just like a tree trunk that you cut in half, your nails can tell you quite a lot. It's quite a bit of a history book over there. We won't go into all these bits and pieces about the nails right now, because all this information, first of all, we will get to a lot of it later on, but also it is available online if you need to have a look at it. But there's all sorts of different things that your nails will tell you. And I've been blessed with some quite strong nails where I can actually even pull out staples and things without causing damage to my nails. But I wouldn't recommend that on a daily basis, because you can actually damage them and hurt them. Fingerprints can also indicate the existence of diabetes, and this is something I didn't know. And one doctor did research, and he had 81% success in basically detecting diabetes simply by examining the number of loops on the index finger of fingerprints. And this is known as dermatoglyphics, which is another big fancy word, but I actually didn't realize that. Fingerprints are useful for a lot more things. Nightshade plants, which include things like tomatoes, potatoes, eggplant, tobacco, red and green peppers, tend to cause arthritic symptoms in some people. And Jim McAfee's got quite an interesting story about a lady who had that problem where he said she would wake up in agony every day and she would cry for an hour before getting out of bed because she was in so much pain. And this had gone on for years and nobody could help her. And he had a look at a diet diary of hers and he said, well, there's your problem. And she'd been eating tomatoes 3 times a day. And he said, you're allergic to that. And she was highly upset with him for telling her that, and said, how can you tell me to quit eating my favorite food? Anyway, after she'd stormed out, she obviously took his advice to heart and quit. And for the first time, after about 2 weeks, for the first time in 8 years, she was pain-free. She thought that this was just perchance. Yeah, it's just one of those spontaneous things. You've had the problem for 8 years, now you stop one thing and suddenly you fixed, but it's just, yeah, it's random. So she had some tomato again, and she was in agony again for the next 2 days. She picked up the hint. Arthritis. Arthritis is simply a fancy term for inflammation of the joint. Arth meaning joint, itis meaning inflammation. Now you get 2 different types of arthritis. In fact, you get a couple of different types, but the main 2 that we are concerned about are osteoarthritis, osteo meaning bone. And this is characterized by bony lumps on the outermost finger joints, as you can see from this picture over here. And these are called Heberden's nodes, and caused by excessive wear and tear of the joints. So you'll find people who do a lot of knitting, people who do a lot of typing, artists, all those sort of activities can lead to the osteoarthritis. And it's a wear and tear disease. And joints deteriorate faster than repair occurs. As you know, our bodies are amazing machines and they will try and heal and repair themselves continuously. So while we are sleeping, sorry, that is when the healing happens. But sometimes the damage happens faster than the healing happens. And infection or physical injury may play a role in damaging the repair process. So pretty much anybody who's damaged a joint through sprains, strains, dislocations, fractures, any of those sort of things will end up with osteoarthritis at some stage. Osteoarthritis develops gradually and often begins with the joints on one side of the body only. And I'll quite often see patients who they'll come in and they've got a damaged right ankle, for instance. And then I'll see them maybe a few months or a year later and they've damaged their right knee. And then they damage their right hip. And then they damage their right hand. All the injuries seem to happen on one side. And I don't know why, it's just one of those things. But they eventually go on to develop osteoarthritis. And you will find redness, warmth, and joint swelling are unusual in osteoarthritis. And it's more a case of a dull aching pain. The redness, the warmth, and the joint swelling is the key difference between osteo and rheumatoid arthritis, because those signs you'll find more in the rheumatoid arthritis, which is it's an inflammatory type disease, whereas osteo is more, as we said, wear and tear. Osteoarthritis commonly affects the knees, which obviously leads to knee replacements, hands, hips, which again leads to hip replacements, feet, and the spine. So most of these areas are the ones that we use most often. And your knees are almost like shock absorbers. So if you're climbing stairs, you're doing a lot of walking, running, whatever, our knees take the brunt of the activity. And those are usually the first joints that go, often followed very closely by the hip. Hands are more for people who are more hands-on, and feet will often go in conjunction to the knees. And quite often, I think the feet problems lead to knee problems. And so your feet being the foundation of your body, and it's this whole big knock-on effect. And the spine, because the feet are painful and the knees are painful, you start to walk in a different manner for balance, and then your spine gives in as well. A notable sign of osteoarthritis is the formation of bony lumps. As we said earlier, it's called Heberden's nodes on outer finger joints. And then you also have a thing called Bouchard's nodes. And so essentially it's where the joints are, they become bigger and thicker, and you'll find that elderly people with osteoarthritis battle to get their ring on and off because their knuckle is now out of proportion. Bony lumps also form on the middle finger joints, more in middle-aged women. And as I said, this is known as Bouchard's nodes. Men tend to develop a tender mass on the back of the hand in the wrist area, so more this area over here. And no, I don't know why the differences between men and women. That is nature. The most common tissues affected by osteoarthritis are the spine, the hips, and the knees, in that order. Joint wear and tear as part of daily living is normal. You move a joint, there's wear and tear. But poor nutrition can make damage of this repair difficult to impossible. As we've always said, if you give your body the correct tools, miracles will happen. And this is exactly what nutrition does. It is not a miracle cure on its own. So our supplements are not miracle cures. They are not medicine. They are not drugs. We're not claiming that they will heal or cure or diagnose or anything. What we're saying is that they are giving your body the correct tools and equipment to heal itself. According to Dr. William Kaufman, given sufficient time, vitamin B3 supplementation can improve joint function in osteoarthritis by speeding the repair process. Vitamin B3 functions more efficiently with omega-3. Omega-3 being an anti-inflammatory, and in my opinion, one of the best anti-inflammatories we can get, because you can't overdose on it and it doesn't have any funny side effects. Research shows that omega-3 oils, apart from B3, decreases both wear and tear as well as inflammation in affected joints. Again, it's that anti-inflammatory property. The combination of vitamin B complex, omega-3, calcium, magnesium, and vitamin C are an optimal blend for joints. And we then can also add in vitamin D for bone strength. And that is why Neolife puts in the calcium, magnesium, and the vitamin D together to help with bones and joints. Vitamin C is essential for preventing excess wear and tear of joints. And vitamin C is water soluble, just like vitamin B. So it helps to oil the joints. It also is an antioxidant. Vitamin C is most effective if taken in multiple doses through the day or in a sustained release form. Whereas we know vitamin C has a half-life of 30 minutes, meaning if you take 500 milligrams in the morning, and this is where a lot of people need to get educated, because I tell this to pretty much everybody who I speak to about it, and almost invariably they go, wow, I didn't know that. I say, yeah, you've taken your 1,000 milligrams of vitamin C this morning, and you think you're okay all day, but you're not, because you take it at 8 o'clock in the morning. By 8:30, you only have 500 milligrams of vitamin C left in your system. By 9 o'clock, you have 250 milligrams of vitamin C left in your system. By 9:30, you have 125. And by 10 o'clock, you have vitamin P, because that's where it's gone. And there's no more vitamin C left, or effective vitamin C. With our vitamin C, it is sustained release. So it will stay in the system, released at a slower rate for upwards of 6 hours. And that is why it is so much more effective. So if people say, but I'm taking a vitamin C, you say, okay, are you taking it every 2 hours? And most of them will look at you with big eyes going, no, but I take 1,000 milligrams. That's where we need to educate them. And yes, our vitamin C is more expensive, but it becomes a lot better value for money if you think that it's staying in the system, actually doing work, not going out. Large single doses will simply flush out of the system. So taking, say, 2,000 or 3,000 milligrams of vitamin C, number one, your gut is going to object very dramatically. And number two, it's not doing anything. It's just going straight through. So it's not a good idea. If you do need to take large doses, it needs to get injected intravenously, and then it can be used quite effectively as a therapeutic dose. Cartilage repair is only as good as the synthesis of glucosamine and chondroitin. These are two of the major building blocks of joint tissue. I'm just watching my time over here. So the suggestions, as we've seen in a common thread, avoid sugar and junk fats because that increases wear and tear. We need to eat a nutrient-rich diet. We need to keep our weight down to avoid excess wear and tear on the joints. And I think I read somewhere along the line, I can't remember the exact figures, but it was for every 10 pounds of weight that you lose, you reduce the pressure on your joints by 2 pounds or something along those lines. I must just get the proper figures again, but it's quite dramatic. And then we need to supplement with vitamins B complex, especially the B3. And the reason we use a B complex is so that your body can take out the amounts of vitamin B and the type of vitamin B that it needs at any given time. And we also need to include C, E, A, and D, calcium, magnesium, glucosamine, and chondroitin. We don't really have chondroitin in our range, but we do have glucosamine, and everything is mixed together over there in a very, very effective dosage in your full motion. There's your vitamin B and full motion. Full motion being one of my other favorite products to use because I was getting arthritis in my wrist and my thumb, and I don't have that anymore. And we need to obtain essential fatty acids from fish, grains, and legumes. And which grains and legumes do we know of? For the oils, we have treonine. And these are essential for repair and immune processes. Did you know that full motion actually is very good for boosting the immune system? There's our salmon oil. Now we get on to the rheumatoid arthritis. And this is what it looks like on a more microscopic level. And this is the more debilitating version of it. And this is characterized, I'm missing my wording over there. Move myself into that side of the screen. This is characterized by an almost universal redness, warmth, and swelling of the joints on both sides of the body. The disease is accompanied by a feeling of illness and fatigue. And it can hit at pretty much any age. According to Dr. James Balch, joints affected with rheumatoid arthritis tend to make a sound like crinkling cellophane, whereas osteoarthritic joints make more of a popping, clicking, and banging noise. And that's where your popping wrists and knee joints come from. That's your osteoarthritis. Rheumatoid arthritis is one of humanity's oldest, most common, and debilitating diseases, and has been associated with allergic responses to foods, autoimmune activity, and infections. And I've seen people as young as 4 or 5 who have contracted rheumatoid arthritis, and I so want to tell them the story of where Neolife started and how Neolife started with what is now known as Formula 4, obviously with treonine, and was able to reverse that rheumatoid arthritis. Rheumatoid symptoms come and go without warning. So you can have a great day today and wake up in the morning and you're crippled. And attacks may be triggered by stress, poor nutrition, illness, or food allergens. The body responds to infection with inflammation. And essentially what it's doing there, it's cooking out any bacteria that might be forming. And this is nature's way of limiting damage from bacteria or allergens. Physicians often prescribe anti-inflammatory drugs for arthritis, but this isn't always a good idea. And if you go to a rheumatologist, they actually prescribe chemotherapy, which is an even worse idea in my opinion. I'll just move my picture over here again so that I can see my words. According to Dr. Thomas Brown, the result of prescribing these drugs for arthritic conditions is catastrophic. His analogy is when any such medicine removes the inflammatory barrier from around the source of the antigen, it is like removing the coolant from a nuclear core, and the eventual result is a meltdown. Think Chernobyl. The inflammation is nature's way of holding the reaction in check. It happens to be a painful method, but it is the only means by which the spread of the source of the antigen is contained. So while doctors mean well, it's not always a good idea. Dr. Brown also felt that bacterial infections such as Lyme disease, sinusitis, tonsillitis, and rheumatic fever or scarlet fever could cause rheumatoid arthritis. Lyme disease being a tick-borne disease and quite prevalent and nasty. Sinusitis, we all know about. Anything that says itis is an inflammation, just by the way. Tonsillitis is an inflammation of the tonsils, which is what part of your immune system as well. Fish, grain, and legume oil extracts can perform the twofold function of simultaneously acting as a natural anti-inflammatory substance and enhancing immune function. Pharmaceutical anti-inflammatories simply suppress the immune function. So they take away the inflammation and don't worry about anything else, and your body suffers even more. Antioxidants play an important role in preventing fat oxidation in the body, as well as supporting the immune system. And oxidation, as we know, is similar to rust. So essentially you can have a look at rheumatoid arthritis as our body's rusting. So if you've got a piece of metal that's rusting, you don't pour more water on it, you put oil on it. Deficiency of antioxidants permits a spillover of the immune cell manufactured free radicals. And this is like trying to weld with a flamethrower instead of a blowtorch. You're not going to get very far. So the suggestions are, again, avoid sugar and avoid suspected allergens. And again, as I said before in previous talks, if you suspect an allergy, please speak to your doctor so that they can do a full battery of allergen testing to find out exactly what your problem is or what your trigger is. We need to consume a vegetable-based diet. We need to consume or supplement with only the highest quality oils, including olive, macadamia, fish, grain, and legume oils. And they look something along those lines. And we need to supplement with all essential nutrients, including antioxidants. In other words, a good multivitamin and mineral, and then your antioxidants, things like vitamin E, vitamin C, carotenoids, etc. Vitamin B complex, especially B6, can be helpful in rheumatoid arthritis. And obviously with our vitamin B, we've got the full range of vitamin Bs. Brittle nails, as I was saying, the nails are quite essential things. Thin, brittle nails that break easily. My mother suffered with this for quite a while, and she also battles to swallow tablets. So she wasn't doing very well with our supplements until I suggested that she takes Liquivite. And since she started that, her nails have stopped being brittle and breaking. They've actually become significantly stronger, and she told me the other day they've grown longer than she can ever remember them growing before. Poor quality nails can indicate digestive problems, protein or biotin deficiency. Women tend to suffer from nail problems more than men. This is often the result of regular exposure to water, washing dishes, laundry, etc., harsh chemicals, etc. And simply wearing rubber gloves makes a big difference. Brittle nails are linked to protein deficiency and will be accompanied by thin, brittle hair and a loss of muscle. Poor digestion is a major contributor to protein deficiency and may also lead to poor absorption of trace minerals, which may weaken nails. Biotin, which is found in egg yolks, kidneys, liver, and some cheeses deficiency, is a distinct possibility. Gut bacteria manufactures most of the biotin we absorb from the digestive tract. So deduce from that, if your gut bacteria isn't working properly, you're going to be low in biotin. Antibiotic use can also lead to biotin deficiency. And poor quality nails are a very good indicator of low hydrochloric acid in the stomach. Iron deficiency may also lead to brittle nails. The suggestions: consume eggs if one can consume eggs. Some people are allergic to eggs, which is a problem. Supplement with beneficial microflora to supply bacteria that can synthesize biotin in the digestive tract. And we all know which one we have over there. Our friend, the acidophilus. We need to supplement with protein, essential fats, trace minerals, and biotin if necessary. And that you'll find in something like the Neolife bar. And we need to use digestive aids if needed. Our best one here is the acidophilus, but you'll also find the enzymes in Neolife Shake. Right, and that is where I stopped now. And we've got a couple of people who have got testimonies. Mandy, would you be able to tell us your story in just a couple of minutes?
Sure. I suffer from arthritis in my hands, and before I came back to Neolife and started taking the products, my hands had got so stiff that I couldn't make a fist. And I've been back on the products just over a year now, and I can make a fist, and they're not sore anymore, but just stop taking the CalMag and the omega-3 and Formula 4, and I take magnesium as well, and the full motion, my hands are as sore as anything. And the story about the tomatoes causing a problem, it does irritate it, and if you just cut down on your tomatoes, it does help quite a bit.
Perfect, thank you very much. Linda, can you tell us your story quickly? Are you still muted? You're muted?
Sorry. I did mention long ago when I did my testimony on a few areas that I had osteoarthritis in my left hip, and CalMag and omega-3 sorted it out completely. But I will mention one, I've got quite a few, but I will mention this one of this guy, elderly man who had rheumatoid arthritis, very bad. He was actually my neighbor. He was on lots of medication for heart and whatever, and also anti-inflammatories. But anyways, I spoke to him about the full motion, and he bought it from me. And after about 2 weeks, he came to look at my heat. He was a retired electrician. And he stood in my lounge and he made all sorts of wriggling movements with his body and start like nearly dancing. And I thought, he's crazy. I didn't know what was going on. But that was actually his way, before he said anything, to show me that he doesn't have any pain in his body with movement even. And yeah, so of course we put it down to the full motion, and he stayed on full motion for a long time, but eventually passed away from, I think, from all the medication of the other things that he took. So yeah, I've got more testimonies, but I'll give other people a chance.
Excellent, thank you very much. Yeah, that full motion is mind-blowing. I won't go without it. Ansi, you had a story as well? Ansi?
Sorry, mine is basically the same like Linda, what she put on the group. That was before full motion was available. It's also my right knee. I couldn't walk. I had to go foot by foot up the stairs. It was awful. And I thought I will never be able to go down to the river at the Berg. But thank God it is better. I don't know anything about it. Also had to go for an op, but thank God omega-3. That's all. Thank you.
Excellent. Thank you very much. And I know I've got a dietitian she was quite a hard sell, but she is a downline of mine. And she was battling with her knees. And I often, well, she shares an office with me, and we often pass each other up and down the hill to the hospital. And she was battling. She's quite a bit younger than me. And she would sort of grab the rail at the stairs and battle to pull herself up one step at a time. And eventually just started using the lift. And I said, go on the full motion. And she eventually decided, okay, she'll try it. And a couple of weeks later, she was running up and down the stairs. And I said, wow, you've done brilliantly. And she said, yeah, that stuff really works. Anyway, then she quit using it because it was too expensive. And within a couple of weeks, she was back to gripping tightly to the handrails and using the lift. And I said, you stopped taking your full motion, haven't you? And she said, yes, I thought it was expensive. I'm never going without it again. And well, she almost races me up and down the stairs these days. So that's another story over there. Excellent. Thank you, everybody. Yeah. Yes.
I just want to very quickly mention that one lady, that's another of my many cases. She had arthritis. I don't know, it was in the beginning of my career. I don't know if it was osteorheumatoid or what it was. And she used the old regular omega-3 and CalMag. And she reported that it was so much better, but her thumbs were still sore. And I suggested, I didn't even have all this knowledge that we have today, but I suggested, I took a chance and said, what about the multimineral? Because there's also zinc and so on and other things. And she took that. And then she reported back, her thumbs are also okay. So I just want to mention that, you know, there's some magic in the other minerals and trace minerals as well.
Correct. And it's all those it's those trace elements that actually make quite a significant difference. And I must say, with the full motion, yeah, it's not just glucosamine. Full motion is quite a technical product because it's got the glucosamine, but it's also got silica, which is good for the bones and the joints. It's got boron. It's got boswellia, which is an anti-inflammatory. It's got bromelain, which is an anti-inflammatory. And it's got white willow, which is a painkiller. So you actually have a very complex, extremely potent product. And when I occasionally get a headache, which thank heavens is very few and far between these days, I use full motion instead of Panado. And I did that sort of almost accidentally because I had a headache one day and I didn't have Panado, and I thought, oh, what can I use? And I suddenly remembered full motion's got white willow, which is aspirin. So I took 2 and I thought, well, there's inflammation, so I'll take 2 salmon oil as well. Well, the headache disappeared. So that's my new headache tablets these days. Right, we are about out of time. So thank you, everybody. I will be popping up this recording soon. And next week, we'll do another couple of short stories as well. And we'll keep going like this. And hopefully we can get a lot more of these testimonies up and open for people to see. So thank you.
Yeah, fabulous. Thank you.
And
thanks for the tomato thing, because I've got lots of pain in my right hand and I need to cut down on my tomatoes.
There you go.
Yeah, I didn't think of that. Yeah.